COVID-19 has been described as the challenge of our generation. Most of the cases in Singapore are among construction workers. In April, an Inter-Agency Taskforce was set up involving the SAF, police, MOM officers, doctors and volunteers to deal with the outbreak among our migrant workers. As a trained doctor myself, I was asked to oversee the medical task force operating in the dorms. Everyone in the task force has been working very hard to take care of the health and well-being of the workers and getting them ready to return to work. Some of you have been asking when your workers can be allowed to resume work. We have been systematically testing the more than 300,000 workers living in dorms to ensure they are well before they resume work. Depending on the situation in each dorm, we use different methods to test and clear the workers. Workers may have to go through a few tests and be isolated for a certain period of time so that we can be sure that they are cleared of COVID-19. This is why some of your workers may have been tested and yet they are not cleared to resume work. We are making steady progress to clear the dorms and the workers. Even then, the dorm operators, employers and workers will have to still make the final preparations before the workers can resume work safely. More workers and dorms will be cleared in the coming weeks. We seek your patience and understanding. Much as we want to speed up the process, we also want to do the right thing and do it right. We do not want to restart hastily, as a single new case could easily cause another outbreak among our construction workers. This will not only endanger the health of our workers and the wider community, but also bring the construction industry to a stop again. A start-stop scenario will likely be much more disruptive than a safe gradual restart. We have so far managed to isolate the infections in the dorms from the wider community. This has kept the death rate low and many of the elderly in our community safe. But if we take this lightly, we may not be so fortunate the next time, and this will put everyone at risk, including our own family members. This is why the task force is also making other preparations to minimize the risks of reinfections. We're working with dorm operators to implement safe distancing measures and step up the hygiene in the dorms. We are also sourcing for more clean sites to temporarily house workers who are cleared and can return to work. But beyond the dorms, work sites must also be made safe so that different groups of workers from different dorms by different contractors coming together on the same sites do not end up cross-infecting each other should any new cases arise. How different groups of workers are transported and housed inside the dorms to prevent mixing between those who have recovered and gained immunity with those who are still at risk of infection must also be put in place. So we seek your understanding that this is a massive and complex task at hand. Resorting, cohorting over 300,000 migrant workers by different dorms, different employers, projects, work sites, immunity status and health status. How do we safely allow migrant workers to interact socially on their rest days at places that they frequently visit? We are dealing with a very smart and infectious virus, and there are no easy solutions. We will need to evolve and adapt as we go along. With your support, we've been able to bring the outbreak among our migrant workers under control. We need to work together now to prevent a new surge of infections. We thank employers like yourselves for helping to take care of our workers' health and welfare and paying them on time. We are now running the next lap, helping you to resume construction work safely. We all want our workers and employers to resume work with a peace of mind. So let us work together to get this right.